Okay, I'm going to go ahead and get started. My name is Dr. Terry Winfrey, and I am the Executive Director of the Chicago Southland Chamber of Commerce. And I'm very excited today to welcome you all to the healthcare webinar. And so we have a lovely group of people that are our committee members, and they plan events like this. So special thanks to our Healthcare Council committee members, Paul Donahue, who is the co-chair, also a board member of the Chicago Southland Chamber of Commerce, and he is here today representing Ingalls Development Foundation.
Thank you, everybody, for joining us on this Healthcare Advisory Council webinar. The topic today, Healthy Hearts, and we're delighted to have a terrific panel of speakers. The panelists we have, as Terry indicated, are a cross-section of professionals working in the healthcare space, including cardiology. We have Dr. Ripple Doshi from UChicago Medicine Ingalls Memorial, who is in the process of logging onto the webinar, and we'll have him presenting specifically from a physician perspective on cardiology and tips for a healthy heart. But we're also delighted to have Christine Rosandich from the Cancer Support Center in Homewood with expertise on nutrition, critical factor in maintaining a healthy heart and good cardiology care. We also are delighted to have from advocate Stephanie Witten presence. She is emergency transport professional. As we know, in any emergency care situation involving cardiology, quality EMS services and emergency transport is just vital in helping preserve life and supporting good quality cardiology care. I would also ask guests to feel free to utilize the chat function and submit your questions on any of these topics. And I know that Dr. Doshi has just joined us. Doctor, thank you for joining us for today's Southland Chamber of Commerce Healthcare Advisory Council webinar on the subject of cardiology care and maintaining good, healthy heart habits, especially during the month of February, which is Heart Health Month. Dr. Doshi, thank you for being with us this morning.
My pleasure. Thank you for having me.
You are the first presenter, Dr. Doshi. If you're okay to proceed, we'll go ahead and stick with the agenda and begin with your presentation. Are you okay to proceed, Dr. Doshi, or do you need a few more minutes to get yourself organized?
No, I'm good to go. I'm just hoping this. I'm going to try to run this PowerPoint presentation. Hopefully, I'll share it. Let me know if there's any problems. 1 second. All right. So it's just a brief presentation, kind of how to keep a healthy heart. As Paul said, February is kind of Heart Healthy Month or health awareness. I think it's even more important now with the pandemic, kind of giving us the limited resources we have in terms of reaching out to patients. So why it's important. Heart disease is the #1 cause of death in our country. Half of the deaths are from coronary artery disease, which means heart blockages, which also include heart attacks. About 300,000+ people die each year from heart attacks before they can even get to the hospital. So I'm an interventional cardiologist who fixes blockages, but probably the more important role I play is as a preventative cardiologist to help prevent people from having heart attacks in the first place. So the importance of keeping a healthy heart, as I said, there are things that you cannot change. You can't make yourself younger. You can't stop aging. We can't choose our parents, so we're kind of stuck with the cards we're dealt with, the hereditary. And there are certain ethnicities, certain areas of the world where people are born from or where their ancestors came from who do have a higher incidence of heart disease. And these are out of our control. However, there are things you can change or things that we do have control over. So, and I'll touch on these in more detail throughout the presentation, but it'll be in terms of your tobacco intake, in terms of your cholesterol, your blood pressure, how physically active you are, your weight, and then your diet. And if you look here, these two pictures are pictures of hearts that a cardiac surgeon took. The one on the left is someone who ate poorly. That's the yellow is all fat covering their heart. And the one on the right is what a healthy heart should look like. And obviously the one on the left is definitely much higher risk of heart attacks than the one on the right. And how you can change, and we'll touch base on these as well, is so if you smoke, the number one thing is to stop smoking. Different techniques work for different people, but it's probably the number one risk factor we see from heart disease. And then know your numbers, which mean know your cholesterol numbers, know your blood pressure, know your glucose or your sugar. By knowing them, you can be more active in your care and hopefully help to reduce them. Get active. Again, we'll touch base on what the recommendations are in terms of how active you should be. Eating healthier, I'll give some tips on that as well too. And then also talk to your doctor, because your doctor will play an active role and kind of help you throughout this process as well too. And not necessarily even a cardiologist, even if you talk to your primary care physician, they're a useful resource to guide you through this. So this is from the American Heart Association called My Life Check. This is the website link is below where it says heart.org/mylifecheck. But this is the different steps you can do to help reduce your heart risk going forward. And within each one of these categories, they have more information on their website. So I'll touch on this briefly, but if anyone is looking for more information, this is a very useful resource. So the number one thing, like I said, about stopping smoking. So the only way you're going to stop is if you agree to stop. So you kind of have to make the initiative on your own to say that I don't want to smoke anymore. And once you've come to that decision, then we have to kind of work together to figure out how we're going to get you to stop smoking. As physicians, we have resources both in terms of support groups we can recommend, over-the-counter techniques or medications we can recommend, along with prescription medications that can also help you to get off the cigarettes. A very helpful thing is try to avoid people who smoke so you don't have the temptation. So if you're in a household with other smokers, it'd be helpful if everyone together decided they didn't want to smoke, or nowadays it's not as relevant, but avoid going to bars or places where people are smoking where you have the temptation or the urge. Staying busy is good because then you don't think about smoking. Also, reach out to other friends and family who may have stopped smoking and ask them how they quit smoking, because maybe what worked for them could also help you as well too. And then once you do quit, make sure you reward yourselves as kind of positive reinforcement to hopefully encourage you to continue to not smoke going forward. And what I said briefly before about knowing your numbers. So these are like the cholesterol numbers are important, and you don't necessarily need to remember these, but just a general rule of thumb, your total cholesterol for everybody, regardless of your risk factor, should be less than 200. Your bad cholesterol, what's called your LDL cholesterol, there's different targets based on different risk factors. Essentially for everybody, the LDL should be less than 130. For certain higher risk patients or higher risk populations, such as if you're a diabetic, if you've had prior heart disease, if you've had peripheral arterial disease, if you've had a prior stroke or a mini stroke, then all of those patients should be more aggressively treated, where your LDL should definitely be less than 100 and ideally even less than 70 nowadays. So usually the first time people are found to have an elevated cholesterol, it would be treated with just medication, with just diet and lifestyle changes in terms of more exercise, weight loss. And then after maybe about a 3-month trial, if the patient still isn't unable to get their numbers down to where they need to, then we would consider potentially medications to help that. In addition to the total and the bad cholesterol, there are other two numbers that come up on a lipid panel are what's called your HDL, which is your good cholesterol. And the higher your good cholesterol, the better or more protective it is. So the goal is to try to keep that above 40. And then another number is your triglycerides, which are the ones that are actually most indicative of your diet. They're the ones that are most associated with your fat intake. And that number should be less than 150. Very commonly, diabetics tend to have very high triglycerides, and there's specific medications you can use to target that. The other numbers that are important is your blood pressure. So for the vast majority of people, I would say everyone under the age of probably 85 to 90, their blood pressure target should be less than 130 with your systolic or your top number. As you get older, we tend to be a little bit more relaxed but anyone under, like I said, about 85, 130 is still the target. And then in terms of your blood sugar or your glucose, your fasting glucose should be less than 100. And then what's called your body mass index, which is your weight divided by your height in meters squared. It's a formula most doctors' offices in their electronic records will calculate it on each visit, but that ideally should be less than 25 is considered a healthy body mass index. 25 to 30 is considered overweight, and actually over 30 is considered obese. Your waist circumference, meaning what size pants that you wear. If it's above 35, that's also a poor prognostic factor going forward. It's what's called truncal obesity. It fits along with what's called metabolic syndrome, which is a combination of high sugar, high cholesterol, high blood pressure, and obesity. So if you are above 35, you should hopefully set a target to try to get less than 35 inches in your waist. And then in terms of exercise, the minimum exercise, most websites will tell you will be more than 30 minutes most days of the week. And actually, it's even a little bit more on the American Heart Association website. And then being active. So what I touched base on. So if this is your first time starting an exercise program, especially if you're over the age of 40 or 50, it's probably a good idea to consult your physician before starting any exercise program, just to make sure it's safe for you to do and that you don't need any other testing before you start the exercise. Regular exercise does lower your heart disease risk, and it also does make your heart stronger. It can actually help you lose weight. It can help you relax. It can help you feel better. The endorphins you get from working out does help depression as well too. It will lower your sugar, lower your cholesterol. So there's multiple benefits, along with also helping your joints and your back going forward. So the American College of Sports Medicine or American Heart Association, their recommendations are moderately intense cardio activity, 30 minutes a day, 5 days a week. So that means breaking a sweat. It's not just a gentle walk around a neighborhood or around a track. You want to do something moderately intensive. So riding an exercise bike, doing one of these kind of high intensity workout videos, swimming, anything like that. Or you can do something more vigorously intensive. So people who play full court basketball or are running, that then you can do slightly less, but it's still recommended you do that 20 minutes a day for 3 days a week. And then the cardio activity, the activity where you get your heart rate up, is important, but it's also important to do some strength training exercises on top of that. So it's recommended at least a couple of times a week to mix in strength training along with the cardio to help keep your heart as healthy as possible. And again, if you're new to starting an exercise program, the key is to start slow and build up to get to these goals. It's if you haven't done anything in weeks to months, if all of a sudden you start doing these moderate or vigorously intensive exercises, you're going to feel quite sore, and it might make you not want to do it going forward. So start slow, gradually build up. We've set, and then look for any chance to be more active. Either when you go shopping, park a little farther away, or take the stairs at work instead of the elevator. Any little bit helps. And there's no right or wrong exercise. For some people, it's running. Some people like the treadmill. Some people like the exercise bike. Some people ellipticals. Whatever you like and whatever works for you, the more you like it, the more you're going to do it. So just find a routine, make a habit, and do it. And just like with smoking, if you can find a partner, if someone you live with or a friend who is motivated like you are, it's going to help keep you doing these exercises and help sustain that exercise going forward. And now in terms of diet, so there's kind of a balanced diet consists of these specific things to help reduce your risk. So your diet, if you can make it more consistent with fruits and vegetables, high fiber, fish, lean meats, fat-free dairy or no dairy, less sugar, little to no salt, and little to no alcohol. These are kind of the recommendations to reduce your heart risk according to the American Heart Association. And I'll touch base on some of these in more detail. So of all your added sugars, you want to make the sugar portion of your diet less than half of the total calories you eat in a day. It's hard to calculate all these numbers, but these are the specific numbers that come from the American Heart Association. So the key is just making sugar a less of a habit of your diet. Avoid the sweets, the after dinner kind of treats, and then also limit your saturated fat and your trans fat. So those are the ones that tend to lead to heart disease the most. So you really want to make fats a very little part of your diet, if at all. If you look at the back of food labels, all of them list your cholesterol. It's not something that we commonly look at or measure, but if you do, you want to keep it under 300 milligrams per day. And the next one, it's sodium. That one's important for everyone, but specifically people with high blood pressure, people with congestive heart failure. You want to try to limit your sodium intake to 1,500 or 1,500 milligrams per day. All this is just about a teaspoon of salt. So this adds up very, very quickly. Almost everything you'll buy in a grocery store has sodium. It's almost like a preservative. So the foods that you know are high in salt, like chips, pretzels, popcorn, Chinese foods, soups, lunch meats, all those kind of things you really want to minimize or avoid as much as possible. And definitely don't add salt to your food. If you do your own cooking or someone cooks for you, try the salt substitutes or other seasonings that don't have sodium in it. And ways to kind of help achieve this is to plan your meals ahead of time. It's when we're hungry, we tend to eat more poorly just because we want to eat anything that's in front of us. So if you plan out your whole week's worth of meals, it can sometimes help you plan better what you're going to make and what you're going to eat and kind of stick to a better diet. If you do, and then things specifically to avoid the yolk part of the egg. If you do eat eggs, stick to the egg whites. Avoid fatty meats and beef. Avoid, if you eat chicken is thought to be healthy, but it all depends on how you cook it or how you eat it. So try like the boneless, skinless chicken breast versus the fried chicken. You don't use butter, cream, lard, shortening, all those other added baking ingredients very often. And then try fat-free or low-fat milk for whole milk. And then instead of frying your food, try baking, broiling, grilling, roasting, poaching, all those different techniques where it doesn't use oil or is it risky. And this is just a kind of quick example of how you can make a pretty big difference. So if you have a chicken breast, and even if you fried it, if you eat it with the skin and the breading, it's about 320 calories. If you could take the skin and the breading off, you're down to 130 calories. So it's almost a third of what you would start with. And even more significantly, your total fat would go down from 14 to 2. Your saturated fat would go down from 5 to 0. Your cholesterol would go down, and the sodium would also decrease by more than half. So this is just a simple kind of quick fix for one meal that could make a big difference if you do eat fried chicken on a regular basis. And then kind of an important way to eat healthier is kind of know what you're eating. So look at the labels of the food you get. A lot of times we're fooled by serving sizes, even like a small bag of chips or something that not necessarily healthy. If you look closely, some of those are 2 servings or more. So whatever number they put on the back of it, you need to double to equal the total number of calories or total number of fat in that little packaging. So it's very important to see what a serving size actually is. And then counting your calories. So a lot of times now on these smartphones, they have apps that you can use to kind of calculate all the calories you eat in a day. And by knowing that number, it'll help kind of keep things under control. And a good kind of healthy number is about 1,200 to 1,500 calories a day for most people. The total fat, also you want to keep it as low as possible. And then also your saturated fat, you want to avoid almost entirely because that will raise your cholesterol and heart disease risk. So you want to choose foods that have, like I said, low percentage of your fat, low percentage of saturated fat, cholesterol, and sodium. And try to get foods that have all the other benefits or the nutritious portions in terms of your daily fiber, your vitamins, your minerals, all in one place. Definitely like raw vegetables, fruits, those are a good source without causing much risk from a heart standpoint. And I touched on a little bit ago about terms of how to cook healthier. So these are all techniques that are potentially better than frying or using a lot of oil. So even things like the microwave, air frying, steaming, sauteing, those are all ways that you can reduce your the amount of calories you're taking in or the fats you're taking in, even with the same type of food. When you eat out, it's a little harder to control the numbers. So it's just most restaurants, I mean, again, we're not doing this very often now with the pandemic, but when you go to a restaurant, most restaurant menus do have low fat or fat-free options. You want to try, if they do, comes with a side. If your main dish comes with a side, try to pick the salad or the vegetable as opposed to the French fries or the more fattening option. Pick leaner meats like chicken or pork or turkey as opposed to beef. Try, if you do get a salad, a lot of times the dressing can be almost worse than eating something that you know is sweet or salty. So try to get the dressing on the side and minimize it. And then for the desserts, instead of like the chocolates or the pies, try to get the fresh fruit. And then, as I mentioned earlier about salads, not all salads are healthy. So if you're adding a lot of croutons, eggs, bacon, the fatty dressings, some of those salads are probably more than a double cheeseburger. So you want to try to eat healthy when you're eating a salad. And when it comes to alcohol, so the recommendation for alcohol consumption is no more than 2 drinks a day for men and no more than 1 drink a day for women. And some people aren't quite sure what they mean when we say a drink. So it doesn't mean 1 glass, however much you want to put into that glass. So what a drink means is either 1 can of beer or a bottle of beer, 1 5-ounce serving of wine, or essentially 1 shot of any sort of liquor. So if you're doing like a double pour of a shot, a double pour of a liquor, that's essentially your 2 drinks right there. So it's by keeping your alcohol intake under kind of low to moderate consumption, it will reduce your heart risk going forward. And that actually is the end of my presentation. This is my email and this is our office number. If anyone has any questions or I would like any more information, please feel free to reach out at any time. Thank you very much.
Dr. Doshi, thank you for your excellent presentation, terrific tips. Again, during the course of the webinar, if anybody has questions, please feel free to enter them in chat, and hope you can stick around with us a little bit longer, Dr. Doshi, in case there's some questions to wrap up the webinar.
Yes, I'll stay on till the end if anyone has any questions.
Excellent. Thank you very much. With that, I'll turn it over to my colleague, Celeste, co-chair of the webinar of the Healthcare Council for the next introductions of our next speaker. Celeste?
Thank you, Paul. And thank you, Dr. Doshi. Our next speaker will be Christine Rosandich with the Cancer Support Center in Homewood, Illinois. And she is a nutritionist there. And so if you could please go ahead.
Good. Hi. Thank you. I had to move locations because I lost connection. So let me just go ahead and share my screen and get started. And gosh, so much good information that Dr. Doshi had shared with us. And so I'm just going to piggyback on a little bit of that and take us in a little different direction. Letting you know that I am a nutrition educator and a health coach. So really, you have to really reach out to your medical provider for any specific questions. So this is all educationally based. But we hear about this, and this is exactly what Dr. Doshi had talked about. So exercise, and it's for heart health, but it's also recommendations to prevent cancer or a relapse of cancer. So I've been at the Cancer Support Center for 14 years, and our center is free to the community, and we offer those psychosocial support. And that's what we're about. We're about the mind, body, and spirit. So that whole person, and that's the direction I wanted to go with today. Looking at exercise and reducing stress and smoking, limiting alcohol, and knowing your numbers, like Dr. had mentioned, but also the quality of your sleep, emotional wellness, reducing processed foods, drinking more water. I think we underestimate the power of water, how that is critical to so many factors in terms of heart health. And then, of course, following a heart healthy diet. So if I could piggyback, Doctor, I'm just going to go ahead and talk about a few fresh whole foods. It seems so simple, but it's not always easy to do. So we are talking about foods that rot, that have one ingredient that come from the ground or a bush or a tree. So these are the foods that actually we're reaching into our vegetable bins and finding, oh my gosh, I waited too long to make that romaine salad. Also, the clean sources of protein that doctor had talked about, but these complex carbs that don't, that help to balance blood sugar. And that's super important in terms of heart health, but also cancer prevention. So making sure that we're looking at, instead of the simple carbs, but the complex carbs, and we'll talk about that in a second. Limit unhealthy fats, like doctor had said. Fats can cause inflammation. And the reason we're concerned about inflammation is it causes that free radical damage that we're not looking for in terms of heart health, affecting all of our organs. So we want to really make sure that our fats are healthy. Not only are we limiting the fats, but that they're healthy. Fiber is our friend. So fiber in terms of 25 to 40 grams, but I do want to share with you that not everybody can digest fiber the same way. So if you have digestive issues, you might need to explore different ways for fiber to be included into your diet. But this would be a rule of thumb for the average person. Remember that 3 grams of fiber is a serving of veggies. 3 grams of fiber is usually a serving of fruit. So it's easy to kind of navigate how much fiber are we eating. I know that years and years ago, when my son was 7 years old, the doctor said my son needed more fiber in his diet, right? He was having a hard time eliminating. And I thought to myself, what does that mean, right? And I think it propelled me into the career I'm in now. But it's really looking at fiber. So if this is an area, if you're having an area of concern in terms of digestive issues, elimination, maybe tracking your fiber every single day, or just at least for a few days, to get a sense, where are you falling in that spectrum? Of course, they're recommending 5 to 6 servings of fruits and vegetables a day. And you have to be mindful, right, to get those in. Managing sugar. So what does that look like? I don't know if you've ever really broke down how much sugar is in your diet, but at the Cancer Support Center, we talk about it very gently, because a lot of us love our sweet treats. But really what we're doing is we're looking at 25 grams or less per day. And that's about 6 teaspoons. How did we come up with that? Every teaspoon has about 4 grams of sugar. So this would be another area for you to look at, perhaps the month of February, to go, how much sugar am I eating? The majority of people actually are getting a lot of their sugar intake through beverages. So, and then of course, men, we're looking at about 38 grams or 9 teaspoons. Most of us are not counting our calories. So it's important when you turn over a package that you see how many grams are in there. And that's probably the easiest way to navigate. You don't have to count your sugar intake for a long period of time, but to get a sense. Do you know that one soda has 40 grams of sugar? So if you like cola or 7-Up or some of these sodas, you are probably exceeding your sugar intake for one day. And then, of course, monitoring sodium. One tip for sodium would be, of course, getting away from some of our if we're making chicken soup, your broth, you want to get that low sodium, maybe using a bone broth instead. Using spices. We teach a lot of spices, how to work with spices at the center, because we can substitute a lot of flavor with spices in terms of instead of salt. And then I love this, the 3 F's: no fried food, no fatty foods, and no fast foods. And that's not easy to do. So what I would recommend is I would recommend never eating fried foods out, because why? We don't know the quality of the oil. We don't know if that oil is rancid. What are they using? Are they using a soy-based oil, a vegetable oil, oils that cause inflammation quickly in our body? So if you're going to have a fried food, I'd probably encourage you to have that at home. Do it yourself. No fatty foods. Try to minimize that again, like Doctor had said. That's why poultry is so wonderful, because you can take that skin right off. And fast food, that's tough, because we like to get our foods prepared for us. And so decide where. My favorite would be Chipotle, because you have some clean, whole food options, essentially. So be looking at that. The other fast food option would be what? Maybe looking at a grocery store, maybe a deli. Don't drink your calories. So if you could just have herb tea and clean water throughout the day, maybe coffee, but leave the sugar to maybe a treat, 1 or 2 treats for the day. And here's a breakdown. A lot of us know this at the Cancer Support Center. You're welcome to reach out and we can guide you through some of these heart healthy diet decisions. But again, we kind of know the proteins, carbs, fats. Doctor went through it. So what we like to teach at the center is 80-20 principle. Have you ever heard that principle before? Has anybody ever heard of that principle? The reason I feel like it's something worthy of discussing is 80% of the time you're eating whole foods. You're cooking your own meals, you're preparing your own snacks, but 20% of the time you can enjoy a snack. So let's think about breakfast, lunch, and dinner. And if every single item on your plate we count as one, many people will eat 4 or 5 items per meal, correct? So by the end of the day, you might have eaten 13 to 15 items. For example, you have oatmeal for breakfast, that's one item, a piece of toast, that's another item, a tablespoon of peanut butter, that's another item. So as you're counting through, what would 80-20 look like? It would only be 2 treats a day. You know, maybe a serving size of cookies or maybe a half a muffin. So be mindful, and this is just a wonderful way to manage your intake of some of these processed crappy foods. So I do want to take us in a different direction. I lost contact with you for a minute there, so I don't know if Doctor talked about stress, but studies suggest that high levels of cortisol from long-term stress can increase blood cholesterol, triglycerides, blood sugars, and blood pressure. So these are common risk factors for heart disease. This stress can also cause changes that promote the buildup of plaque. So we know that depression and stress do affect the heart in different ways. And we know from the CDC that anxiety, depression, and stress can affect that heart as well as other health issues in your body. And boy, have we had a rough year, haven't we? It has not been easy. And at the Cancer Support Center, that's what we focus on, is that psychosocial support. And so I'd like to just take a minute and talk a little bit about mindfulness and stress, because I think we underestimate what that actually does to our body. So we have to look at that whole person, the physical side as well as the mental. And we have a tendency to brush off the emotional aspects of heart health. We're starting to understand how it's been affecting our young people in the lockdowns for the last 6, 8, 12 months. Remember, the negative self-talk or the words our inner dialogue uses when we think can increase stress levels. So you might be thinking, Chris, as a nutrition educator and health coach, really, do we have to be focused in this area? I feel like it's especially important for 2021 for us to look at how are we managing emotions. And there has been research to support that there are 4 emotions that can affect our organs: frustration, resentment, anger, and forgiveness. And these are areas that we might want to explore. Um, so we know that stress day to day can increase with negative self-talk, and it can cause us to become frozen. Have you ever been in a situation that you've gotten in a pattern where you're eating poorly? So you're eating a lot of processed foods, a lot of sugar, and you feel like you can't break that cycle. You just feel frozen. And so what happens is that's the cycle that we're in. We're not following these heart healthy practices. And then we have a tendency to beat ourselves up emotionally. And then we feel the guilt about it. So how do we break that cycle? Let me just give you a couple of suggestions. First of all, just to determine a baseline. What would you like to achieve in 2021? I mean, you can look at just February, you can look at it quarterly, but what's important to you? Start with really small goals. And I love this concept 2-minute rule. If you would allow me to, I'd love to do a shout out to one of my favorite authors, and his name is James Clear. Have you ever heard of James Clear? He wrote the book Atomic Habits. So if you're very goal oriented, or if you want to make some changes in your behavior in 2021, he wrote a book and it's absolutely phenomenal. And you actually can go on YouTube videos and listen to a little bit of his lectures. And he talks about the 2-minute rule. He talks about, think about goals in terms of 2 minutes. So for example, you're making dinner, you get yourself fatigued, you go to sit down. But instead of sitting down, the 2-minute rule would be, go ahead and put some of the dishes away. Go ahead and put some of the food on the counter away. 2-minute rule. You kind of just jump in because everyone can do something for 2 minutes. It's the same thought process as, I'm tired of exercising, but you know what? Maybe for 2 minutes, I'll get on the floor or I'll stretch. I'll stretch in a chair. So you're thinking about things in terms of 2 minutes. And what happens after 2 minutes? Sometimes we get a little motivated. Last night, I did not want to get on the treadmill, but I thought, Chris, get on the treadmill for 10 minutes. Well, I wound up staying on there for 40. And boy, emotionally, I felt so good. So we have to focus on our own self-care. And that's what we talk about at the Cancer Support Center. So we're looking at this deep breathing. Are we reading for fun? Or are we calling a friend? So we need to evaluate and focus. So here's an example that I wanted to share with you. I know I probably only have a few more minutes, but our goals might be, especially if you're a high achiever, you want to exercise at a maximal level, heart healthy diet, manage stress, and find joy. I know that finding joy in my life for 2021 is a focus. But what happens is throughout the day, you might really not get to exercise. You might make yourself a great breakfast, lunch, and dinner. So you might have oatmeal in the morning. You might have a salad with some salmon. And for dinner, you have chicken breast that you took that skin off with some steamed broccoli. So you really did great with your heart healthy diet, but life at work wasn't easy. You just, family life, things are going wrong. And so you're feeling that stress. Tomorrow, it might bring a whole different scenario. You might be like me and you jump on the treadmill or you walk down the street for a little bit of fresh air, but you ate more processed or fast food. So what we're trying to do is understand that life is a journey and be gentle with ourselves. We have to be able to ask ourselves these questions. What is keeping you from exercise? What's keeping you from a heart healthy diet, from enjoying that? And that might just be half the day, right? What is your stress level? Are you practicing self-care? Are you gentle with yourself, or do you have a tendency to beat yourself up with that self-talk? Okay. So these are my favorite words, and they might be simplistic, but I tell you, when we stay mindful on some of these words, they can help us manage stress. Um, in terms of meditation, if you're a Netflix fan, there is a really neat meditation that only lasts 10 or 15 minutes long. It's kind of a cartoon type of look at meditation, but it's wonderful if you're not one to meditate or do a guided imagery. And of course, we offer these online programs at our cancer center free all of the time, and you can jump into a meditation or guided imagery there. So these are some of the fun words to focus on. And I just wanted to conclude my talk with, we do have, this is just a shout out, but on the 20th, there is a program we're offering online, and it's called Say Yes to Wellness. And I feel like this is really particularly important to heart health, because when we manage stress, we are saying that we care for our entire body, including our heart. So those are just some tips. I know I probably talked too quickly, but what I wanted to do is give you this overview. Yes, diet is important, but managing stress and looking at how we self-talk, are we looking at self-care? Is that important in our lives? But thank you.
Thank you, Christine. Thank you very much. Stephanie Witten from Advocate Aurora Health, EMS coordinator. Please, I'd like to welcome you to our panel.
Thank you. I'm going to share my screen. So it's not allowing me to open a presentation. Let me try again. Sherry, did you do that? So anyway, so in consideration from time, instead of a presentation, I'll just kind of discuss what we've had. So my conversation is going to be about how EMS was affected by EMS transports, hospital volumes are affected by COVID. We saw a large volume of patients who were not coming to SharePoint. Do you want me to do this, Sherry, or you just want me to talk?
Stephanie, it's saying that you can share, so I'm not sure.
Right, but it's not letting me go to my files.
Okay, well, it's open on my end for screen sharing.
So what I have right now, if I have basic, advanced, and files.
Okay, so you need to pull up your file that you're going to share.
Right, but it brings me to Dropbox, OneDrive, Google Docs, and Microsoft SharePoint. It doesn't bring me to where I can open my computer files.
Yeah, that has nothing to do with Zoom, so I'm so sorry.
That's okay.
I don't know how to advise you on that.
That's okay, Stephanie.
That's okay.
You can just go ahead
I'll
and
talk through it. Right. So all I was going to show you guys basically was numbers 2 and just explain what the numbers mean. So when Celeste approached me, the conversation was, how was ambulance transports, how were our ED volumes affected by COVID? So just know that we really didn't collect specific data that related to COVID, but we do collect data on the number of patients that come to us, and the state does collect data on ambulance transports. I also reached out to the hospitals in Region 7 and asked some specific questions. The first question was, did your ED experience a delay in treatment when patients arrived for MI and CVAs? So again, the data wasn't necessarily there to prove or disprove this occurred, but what we found is the volume of patients that came in through ambulance was not decreased. The volume of patients who came in through our emergency front door was decreased. the type of patients that we received was altered as well. So early on, when COVID first started, we saw a decrease in our STEMI patients, but we saw an increase in our stroke and cardiac arrest patients. There was no delay in treatment for those patients that arrived at our hospitals or that called 911. But we did find in talking to many people who did come to us, they did wait a period of time because they were concerned about the COVID virus being in the hospital and catching it that way. As far as COVID cases, our numbers increased quickly, and we held in our hospitals lots of COVID positive patients and a lot of symptomatic patients that were waiting on test results. We did see a decrease in our other type of patients. So at some point in time, most hospitals became what you could easily call a COVID hospital, because most of our patients here were COVID patients, and our ICUs were filled with severely ill COVID patients. We did, as mandated by the state of Illinois, we did, excuse me, have to cease our non-emergent procedures. Those recently opened up again, and immediately the numbers started to rise. We still did our urgent, emergent type of procedures, so those never stopped. We just kind of had to relook at how we were doing them with the PPE that was required, you know, and some of that increased the amount of people you had to have to take care of the patient. It changed the process for registration and testing. As far as EMS transports go, when you look at the numbers, when I dug in deeper as to what type of patients were we seeing, were we not seeing via EMS, we saw a decrease in our sexual violence and our suicide attempts, our self-harm patients, our suicidal patients, mental health patients. And if you think about why that may have occurred, you think about when people leave your home, you actually have more resources. So you're going to work, you have people to talk to, you have people who notice your behavior that something could be wrong. When our children are going to school, they have those school resources. By staying home, people were not able to have those resources, so their ability to seek help was not there. When we looked at over the year, what increased, our respiratory went up by 37%. Our firearm injuries went up by 26%, which tell you, again, the kind of looks back at the mental, emotional state of people having to stay home and be in different environments. And earlier when Christine talked about stress and how this last year has been very stressful, when you look at the stats, these stats kind of show that that has occurred. As I broke it down month after month, I looked at the hardest hit months for us early on, which was March through July. And overall, the volume of EMS calls were up. It was the type of call that changed month to month. For instance, in March, the highest increase in calls were for firearm, unintentional injury, heat-related, and COVID-19 was actually third. When we look at the calls that were decreased, our STEMI calls were down by 5%. And out of the top calls, stroke or cardiac arrest did not even appear in those types of transports. Looking at April, our influenza went up 58%. Our COVID was still at the top at 42%. Cardiac arrest by April had increased by 14%. And then if we look at the decrease, we're seeing that STEMI was down by 18%. So you're seeing that those really sick patients who needed to seek care weren't doing that. And I'm sure, as most of us had talked in healthcare, as I surveyed people, that the perception is the fear of coming to the hospital, because when you watch the news and you saw how impacted hospitals were, and ICUs are full of COVID patients and our floors, and we don't have any beds, and they're showing pictures of the waiting rooms, you're seeing that it's scaring people to come to the hospital. May, the numbers stayed the same, although we did have STEMI drop down to only 1.5% of a decrease. Stroke increased by 25%, cardiac arrest went all the way up to 40%, and May was about the time that we were noticing the nursing home or extended care facility impact of COVID and those patients coming to us. So again, that makes sense that our numbers would rise to 40% because we started getting a lot of those nursing home patients or the rehab patients coming to us. when you look at the overall, and I know we're on time, so I don't want to go too far in, but cardiac arrest in July and August dropped down. Our STEMI started going up again. Our stroke started going up into August. When you look at the whole month through, or excuse me, year March through April, overall, our STEMIs were down by 8%. Our cardiac arrest increased to 20%. And our stroke patients, actually, the increase was up by 17%. So what the difference was between the STEMI and the stroke and why people came who were having strokes versus those who were having STEMIs, we don't have the data to show that, except that I believe people are much more educated about the subtle signs and symptoms of stroke than they are of your potential cardiac patients. And people have very subtle signs and symptoms for cardiac issues. So I believe that played a part in maybe them not recognizing them early, or maybe blowing them off as, well, I'm just stressed. I've been at home. I'm working at home. I'm taking care of the kids, right? Where the stroke is pretty much out there and they're very well educated on that. One other thing that impacted EMS transports and what the hospital received. So our hospital numbers went down. Our ED numbers went down for the what they call level 4s and 5s. So for the non-emergent, the patients that would come for something that maybe they would go to their family practice for, or to a small clinic. So those types of patients basically quit coming to the hospital, which decreased our volumes greatly. Oh my gosh, and I just lost my train of thought. What did change for EMS though, for volume, was that each EMS system pretty much looked at COVID and the type of patients we were transporting and the volume in the emergency departments, in the hospitals. And they said, what patients really need to be treated and taken to the hospital? And what patients can we talk to in the field and say, you're better off, safer at home following these steps and calling your family doctor or giving them a doctor to call. So our volumes decreased in the hospital setting for probably about a 3 or 4 month period of time. They are certainly back to normal. We're all busy. Our houses are still filling up like they should be. What we're not seeing is a high volume of COVID patients anymore. We're also not seeing a high volume of flu patients. Again, why that is, there's no data for that yet. But the transports were definitely affected. The cardiac patients were definitely affected by COVID. And by the time they sought care, again, I wish I had better information for you, but we didn't survey patients as to why they waited for so long. We're just presuming that it was the fear of COVID. Okay, that's all I have.
Thank you, Stephanie. Terrific presentation, really good insight that is probably about as fresh a data analysis and delivery that we could possibly imagine. So really the amount of time that it required you to get that information and share it with us, very much appreciative and very encouraging as well to hear that the volumes of patients are coming back closer to your normal levels and the level of COVID related patients are going down. So excellent presentation. Excellent presentation as well from Christine. I love the point about mindfulness and taking care of yourself in addition to nutrition. So excellent remarks from you, Christine. And then of course, Dr. Doshi, very much appreciate your presentation as well. With that, I'll open it up for any questions that anybody may have for the panelists. I know that I'd like to hear, from you, Dr. Doshi, a little bit about what you have experienced during the pandemic. Has there been increased levels of anxiety that may have contributed to deteriorating, cardiology conditions, or has it been about the same? Just what has been your observations over the last year related to the pandemic? I think you're still on mute, Dr. Doshi.
So sorry, I would kind of reiterate what Stephanie was saying. We've definitely seen a decrease in our ST elevation MIs or acute MIs since the pandemic started, for most likely patients being afraid to come to the hospital. Maybe by not going into work or not driving, there's a little bit less stress, But I think across the country, it's probably closer to 20 to 30% decrease in MIs. It's not a small decrease. There's been earlier on when we didn't know as much about COVID, there's definitely much more, I think, of a stress from a healthcare provider standpoint in terms of dealing with COVID patients and the PPE and kind of seeing a large burden. I mean, at one point, probably 1 in every 5 or 6 patients admitted to Ingalls was a COVID patient at its peak. So it was pretty rampant. It's fortunately slowed down. It hasn't gone down all the way to 0, and it probably won't for several more months, but it's become much more, I think, manageable, kind of more of a routine. We are seeing kind of volumes hopefully picking back up where patients are getting their routine care and not being afraid to come to the hospital anymore. So I think that's good. And I would definitely encourage, if you have symptoms, don't ignore it. It's better to come to the hospital and be sent home with nothing than stay at home and have something severe happen to you.
Dr. Doshi, thank you for your comments.